Welcome to the London Free Press Podcast. I'm your host, Rachel Gilbert. Well, London Health Sciences Centre and St. Joseph's Healthcare have decided to go their separate ways, and that means scrapping a formal collaboration agreement, which affects many moving parts. And while both sites are planning to move forward on their own, many people in the community aren't happy with that decision. And so today I'm talking with London Free Press health reporter Jennifer Bieman about the reasons for the separation and how things are going to work moving forward and some of the reaction that this decision has been getting. Hi, Jen. How are you?
I'm fine, thank you. Thanks for having me.
Yeah, we haven't had you for a while, but this is a huge story. I know you've been working on this for the last week at least, because there's been a few stories about it and it's been very well read. So let's just kind of start from the beginning. What has been the partnership agreement between the hospitals up until now? Because I think a lot of us just assumed they were one and the same. There was no agreement. It was just, they were just always together, but there was some agreement. So what was it up until now?
Yeah, so St. Joe's and LHSC go way back. They're good friends. They've been partners and kind of collaborators for a really long time. Even though they're governed by separate boards and they have their own presidents and their own sites and their own specialties. LHSC has our emergency rooms. St. Joe's does all kinds of other stuff in specialized care, urgent care, hand and upper limb, eye care, all that stuff. But they've worked really close together, and they had an agreement, the two of them, a 16-page joint collaboration agreement. It's a fancy word for just sort of terms of reference for how they were going to get along, a framework for who would handle what. Some of them for years had integrated VPs that were like on the executives at both hospitals in areas like research and even kind of medical type things. And LHSC has decided that it doesn't want to continue with that type of collaboration, and that has implications beyond just things like integrated VPs. It has implications for some of the shared ventures they've launched, such as you know, basically their medical supply procurement buying group, HMMS, and also Lawson Health Research Institute, which is something that I think a lot of Londoners know because it's the medical research arm that we talk about a lot in the news. Actually, does a lot of really cool things. So it's quite a big split and a bit of a departure from what we've been seeing from these hospitals for decades.
So the big question is why? What's the reason for the split? Why did LHSC want this?
So LHSC's reasons are, things have changed in the health system over the years, especially in the pandemic. And so there's a lot of need to be more collaborative, for thinking bigger in your collaborations, partnering with other organizations that aren't just hospitals. That's what they're saying. With St. Joseph's, you can tell from some of their board minutes that this was not something that they really wanted to dissolve. You can tell that there was sort of a reluctance to do it, a kind of, can we talk about this? Do we really want to scrap this? Please don't. They're very stoic about it. They're moving forward. They know that this is the new reality, and they're going to continue to do the great work that they do, just as LHSC will continue to do great work for London. But it's sort of just LHSC saying, it's time to kind of move beyond what we've been doing. Yeah, that's kind of the answer they've given me. Yeah.
Do we know any specifics of how things will now separate and how they will each move forward on their own and maybe
Well,
how that will be better? Because that's the point, I guess, of doing this.
well, that is the big problem. And that's one that a lot of the people I've spoken to have said is that, it's one thing, not that, nothing should ever change ever. I don't think that's necessarily the goal for anybody or healthy for any organization. But, LHSC hasn't necessarily come out with specifics. A consultant's report, a sort of a 5-year plan of like how this is necessary and why this is necessary. We don't have dollar figures or really exactly kind of a lot of answers on exactly how this split will play out. So in that way, we're going to have to kind of stay tuned and see exactly what it means for that relationship. Both have said that they want to continue to be friends and get along. But, without that joint collaboration agreement, without integrated VPs, there's a lot of questions just about even doctor credentialing. Like, right now, doctors can kind of flow between both. They're accredited sort of on a citywide basis. What does that mean now?
Mm-hmm.
Not even that long ago, those hospitals shared a president, Cliff Nordell, back in 2010. Who was, that was kind of it. And so this is just a big departure. The people I've been speaking to are really worried. They just don't know why they haven't been faced with sort of dollars and cents reasons why. And I think that's kind of the sticking point for a lot of people.
When did we find out about this? Because obviously the two boards have been discussing this for a while, but when did we find out exactly?
So I'd heard whispers quite a while back, earlier this year, just about the big divorce. Have you heard about the big divorce and the big
Mm,
split? And it was all very kind of speculative and not totally clear. It wasn't until probably about April that I managed to sort of figure out exactly what was on the table. And I'd had a lot of people come forward and say, hey, this is what's at stake. And people really try to sound the alarm about it because they saw this path that they weren't too on board with. They'd sort of seen the system kind of work from the inside, and we're just unsure about this new direction. So that's been kind of what we've been working on at the Free Press for a little bit now, to kind of get the details on it, the nuts and bolts of kind of the reasons for the departure and the change,
hmm
and then kind of its implications for some of its joint ventures particularly.
Yeah. Does the pandemic play into this at all? Like, was this a discussion pre-pandemic or post-pandemic? Did that play into this?
The pandemic is something that has been mentioned by LHSC's president as really a moment to kind of reevaluate, you know, priorities and systems and how things are working. I mean, that was a reflection point for a lot of organizations and
Yeah.
industries about just, especially hospitals. And, in the province too, we had a change of government in 2018. So there were kind of changes afoot there about how hospitals relate to each other. So we kind of moved into smaller regional entities instead of the big, large LHINs. So there have been changes in the system, province wide and post pandemic, that have kind of contributed to this. I think we'd be remiss to say as well, LHSC has had a lot of changes in the last couple of years, just on its governance side alone.
hmm
So it had a kind of an abrupt termination of Paul Woods. There was litigation involved there that's now being settled. We had Jackie Schleifer-Taylor come in, and we've had the departures of quite a few executives there. So there's been a lot of change, kind of system wide and locally, that may have all had, you know, kind of reasons for this direction.
Yeah. Played a role in there.
Yeah.
You've gotten a lot of reaction on your stories online at lfpress.com for sure. Let's talk a little bit about the reaction, because there's a lot of reaction from community members. There's a lot of reaction which you got, and you've talked to some former executives who actually had some things to say about this. And it seems like the current LHSC CEO, Jackie Schleifler Taylor, is getting a lot of the blame for this. Is that fair to say?
That's true. I think people, it's easy to point to the head of any organization and say it's this person, right? And she's kind of, relatively new on the scene. She took over in 2021.
hmm
So, a couple of years in the job. You know, some of the former executives I've spoken to are just sort of, they're just worried. They just don't understand the why. I think, it would help eventually, and probably as time goes by, we'll understand a little bit more about exactly why it's necessary. And, and that would be definitely helpful. It's sort of funny, these stories, because really at its core, it's about hospital governance, which isn't the most sexy news topic, but we've had a lot of readers, a lot of response from people, because our hospitals really matter to Londoners. Londoners are a really big healthcare city. LHSC and St. Joe's, and also Western, which is also kind of caught up in this because they'll have to make partnerships with the hospitals as well.
hmm
Um, you know, it matters to people. And so I think that's kind of it. Is I don't know that many Londoners want to see a lot of change that could hurt them or change what's happening. So change is difficult, but certainly in this sector, when health is so valuable and healthcare matters to Londoners, I think that's kind of resonated with people.
Yeah, I think that we, as Londoners, we're so proud of our healthcare. We have such excellent healthcare here. So this is a bit of a shock whenever there's a change. Will this affect patient care at all?
The two presidents say no. They say this is sort of back end necessary changes that are being made for hospital governance reasons. The critics say, how could it not? For the last many years, the hospitals have been collaborating. They've had agreements. They've had, again, the flow of doctors, citywide credentialing, the really tight partnership with Western, and they're just concerned that we've spent so much time and effort really tying both hospitals together operationally,
hmm
that dividing it, surely, the reason to collaborate is to find efficiencies and really make things more streamlined and work together. And in splitting it apart, they just not entirely sold on the fact that that's going to be better for anyone.
Sure, absolutely. You did write about the supply chain, the healthcare materials management services, HMMS. And that is something that LHSC is going to back away from. But what are the changes that you see happening there? What will happen? What have they said so far?
So that one's really interesting because, this hospital split in London and this sort of change in the dynamics between them and the relationship between them kind of has implications for other hospitals now too.
Hmm. Hmm.
HMMS was one of those pandemic success stories in the early, kind of that summer of 2020. They worked overtime to get masks for people, right? Like they were really, really on it. And that organization supplies 30 hospitals in the region. So, it's a joint partnership. It's been around since 1997, employs a lot of people. With LHSC backing out, St. Joseph's has, and just, in yesterday's story, they said, we're really looking at ways to continue this. We're trying to figure out a way that works. We want to, kind of keep this. And they have first right of refusal to, buy up properties and kind of keep it going. So it sounds like from St. Joe's perspective, as the last remaining partner, they're looking at keeping it going. Regional hospitals are certainly paying attention to this, though. A lot of them really depend on HMMS for their medical supplies, and they have for years. So there's kind of that feeling here. There's still quite a bit of time, though, on that contract. It's till March of 2024, and then there's like a 6-month extension they can kind of negotiate as well. But it really will be all eyes on that organization for sure.
Will there be jobs lost in this transition, do you think, or will they be adding people to each hospital site? What do you see happening there?
It does sound like time will tell on it. St. Joe's is really trying to figure out what's next for HMMS and what that future will look like. It
Yeah.
does sound like, though, that there's an appetite to continue it. It's been a great partnership from the outside looking in, anyways, just
Yeah.
for all those years, and that's kind of been the way it's been. State or LHSC is moving towards a more provincial type supply procurement process. Other acute care hospitals in the province, like LHSC, have been doing that. So that's kind of their reason. And they said that what we were doing locally just wasn't making financial sense for them anymore. So that's their why. But I guess we'll have to just see what's next for HMMS locally.
What about and you mentioned the smaller regional hospitals and the supply issue, but what about the separation and how that will just generally affect local hospitals because they send people to London all the time?
Definitely a good question. We don't really know yet. Referrals are referrals, and if you have a hand and upper limb condition, you'd probably be referred to St. Joseph's.
Mm.
If you're having a baby, maybe you get referred to LHSC because they're in the baby birthing business. So, in terms of kind of that situation, it would seem that patients that need the care that St. Joe's can provide would be referred to St. Joe's, and the same for LHSC. I think just that the big thing will be patient flow between the organizations, which both hospitals have said, electronic records will continue to be shared, which is really good. So if you end up in the ER at LHSC and then in urgent care the week later, that those records should be shared and integrated. So that's something they've committed to continuing. But yeah, it'll be interesting to see what patients see, if they see anything.
Yeah. There are some efficiencies, as you mentioned, that will be still there between the hospitals. So it kind of begs the question again, why are we doing this? What's the point?
Yeah, that's the question. That's the $1 million question. And I think,
Right.
time will tell, and there will be kind of reasons and answers. LHSC is really embarking on a big kind of master plan thinking about what its, next 30 years will look like. And they've done a lot of public consultation this spring and winter about it. So, and they're also looking at a redevelopment, I think, on at least part of their Victoria Hospital site, and including a mental health ER we've reported on in the past. So
Mhm.
it'll be interesting to see the future directions of these hospitals. The one thing that they've made very clear, the presidents have, is that they really want to stick to their core mandates and keep doing what they do well. And they do want to keep collaborating, although without this sort of formalized arrangement that has been in place for so long.
Mm. Okay. So would it be fair to say more people are worried at the moment than supportive of this agreement or this action?
From what I've heard, yes, the people that are reaching out to me are not necessarily happy with this. They don't understand the why. They'd
Mm.
like to know the why. I'm sure that they could be potentially persuaded if they were given a good answer. But no, I think it's a bit uncertain. A lot of questions still, and we'll
Right.
certainly keep following it.
Absolutely. Well, and we will keep following your stories definitely at lfpress.com because we know that you'll be on it and that you're continuously talking to everybody in the health sector. So thank you so much for joining us today.
Thanks so much.